Hi Jen, hi Jackie, it's Tracy here from Tim Boone Healthcare, and we're going to do our practical assessment and a few other little things along the way. This is our lovely new mum, Bronnie.
Hello.
And Bronnie's come to join us, and she's left her little 5-month-old baby asleep over in the corner, and you've been a little bit active. What have you been mainly doing since having the baby, Bronnie?
Trying to get sleep really is my just walking out with the pram, been doing a bit of that.
Have you been getting enough sleep?
Yes, I've got a very good baby, but yeah, not much more than a walk with a pram, maybe once a day. Yeah, feeling 5 months, but ready to get back to some exercise.
Sounds good.
Yeah.
Well, your medical clearance read pretty well that you've had your 6-week postnatal check and you're feeling okay about where things are at. Is there anything else that you wanted to add? Like your normal vaginal delivery went well. Yeah, you pushed for a little while though, a couple of hours.
Yeah.
Yeah. Did you have any huge big tearing or anything like that that took a while to recover? Or
Had some stitches.
yeah.
Yeah, but no, recovered pretty well, I think.
And
I don't know. Nothing. It's hard to know what you've got to compare it to. Really.
Yeah. What's normal, really?
Yeah.
And what about your tummy? How's that feeling?
Fine, but I haven't put it under any, any pressure or any testing. So
Yep. Yeah. Well,
feels good.
Good. Good to hear. Well done, you anyway. It's pretty amazing that you've pumped out a baby, made one, and then an organ, and then all of that extra stuff, and then had it. Good job.
Yeah. Good on me.
Yeah. All right. So we might just do a little bit of a check to see how your tummy is going. So I might just get you, if that's okay, just to lie on your back, if you're comfortable to do that, with your knees bent a little bit. That's it. Beautiful. That's it. And what we're just going to check for is a bit of abdominal separation that has to happen so this baby of yours has grown from a little tiny thing to the nice, great, big 6.5-pounder that he was. So good job. So we're just going to check that. We'll teach you a little bit more about how those muscles have moved and developed and changed. But we're just going to check to see how that abdominal separation is. So you okay if I just lay my hands on? Yeah, great. All right, so I'd like you just to relax back. Find your happy place. Beautiful. Okay, all right. So what we're going to do is in a minute, I'm just going to get you to, when I say go, just lift your head. I'm just going to push a little bit in here and just see how much separation there is at 3 spots. First in the middle, and then above your navel, and then below. But then what I'd like you to do now is just to relax everything off. Yeah, that's it. Lovely. And just cross your hands across your chest so that you're kind of holding onto your shoulders. That's it. It's still nice and relaxed here. And when I say go, you're going to lift your head, and although you might want to use your tummy muscles, just keep them nice and relaxed as well. All right, so just to find your navel, I hope that isn't too ticklish.
No,
all right, so when you're ready, just lift that head. Yeah, that's it. And shoulders up a tiny bit more if you can. That's terrific. Good. And back down again. Fantastic. All right, we can do that again. That's the one. Good. And down again. I'm just going to go down below your navel now. And off you go. Lifting your head when you're ready. Good. And lower down. Now, how does that feel when you were doing that? Did you feel any sort of, what was going on down there?
The lower one was different from the other two.
Yeah?
But no, I can't really feel.
Okay, we're just going to do it one more time. So I just want to have another little feel. All right, when you're ready, lift. Yeah. And lower. And above. Here we go. Lift. Good. And lower. And we're going to go back down again here. And one more time. Off you go. Lift. Good. And lower down. Good job. All right, so I can feel about a 2-finger separation. So 2, well, you can have up to like, whole hand across there if you like, which is not ideal, but the closer they come together, usually the stronger it is. But it's not just about how wide it is, it's about how stable that is. So you could have like a 3-finger gap and have it nice and stable and it's activating and working as it should, or you could have a 2-finger gap, 1-finger gap, and you can like press right down into the spongy part. So to have a 2-finger gap and know that that's activating nicely is normal. So that's pretty good. Yeah. So well done. That's a good place to start. All right. So what we're going to move on to now is just some pelvic floor activation. So how would you rate your pelvic floor when we did our medical clearance? Did you give it a bit of a mark out of 10?
It wasn't good.
No. So it's changed since you've had the babe.
Well, I don't think I did much thinking about my pelvic floor. I don't know. It's still really difficult to know whether you're activating it properly. Yeah.
Yeah, fair enough. Yeah. So it's that's why it's really good to have contact with a women's health physio, because there's only so much you can do from the outside through touch and feel and giving yourself feedback or me feedback. But that's why having a women's health physio who could do a real-time ultrasound, so they put the ultrasound up down here and ask you to contract your pelvic floor and give you feedback on how well you're doing that contraction. Sometimes they can tell you whether you've got a more effective contraction if you're going from front to back or back to front or in a different position, and then they can give you set prescribed exercises depending on what your ultrasound tells you. Yeah, it's a good idea to hook up. We've got a couple of contacts we can follow up with that a bit later if you like. If you choose not to, that's cool, but we'd always recommend it. Yeah. Okay. So what we're going to do now is I'm not going anywhere near your pelvic floor, Bronnie. Don't worry. So
just get the glove on.
So just have a little relax back down into that position again. Do you feel like you can contract your pelvic floor? Activate it? Make it happen?
I think so. Yeah.
Okay. How about you just pop those hands back down onto the side here?
Yeah.
Yeah, just there. That's okay. That's good. So I'm just going to put my hands here and here, and this is on some other muscles that are kind of all linked and related to your pelvic floor. We want to kind of fire them in the right order because we've got some bossy muscles and we've got some not so ones. So we want your base level, your inside out muscles to do the work first. Once again, we'll come back to that later. So what I'd love you to do is just to I'll just do a little pelvic floor without me telling you anything. Tell me when you've got it switched on. Yeah.
Oh.
And relax. You right?
Yes.
What happened then?
I'm just old and my back grabbed. Yeah.
Oh, you're right. Okay, well that's
because I'm not 50 at all. Yeah.
No, but that's feedback as well. Like, that's okay.
Yeah.
That's all good. Body's full of messages. We've got to figure out what they mean. All right. So what we're going to do is we're really going to isolate your pelvic floor activation without using any other muscles. So when and if you go to a pelvic health women's physio, they may ask you to start from the back or the front, or with your ears or whatever it may be.
Yeah.
But what I'd like you to do is to keep everything, all of your muscles, your skeletal muscles, nicely relaxed. And I'm going to ask you to contract your pelvic floor just from the front passage. Yeah. So this is like you've got a tampon in.
Yeah.
And you're drawing it in and up. Yeah. Well, good. I can feel some movement going on here. That's good. And relax. Okay.
Try again.
Yeah. And again. Yeah. And relax. Okay. All right. So this time, I can feel some action going on here under my thumbs. And what I would love you to do is to not activate through here at all. It's just your fanny bits, just your frilly bits.
Okay.
All right. So another story that you can tell yourself other than the tampon story. This is my favourite. Is the blueberry.
Oh, okay. Right.
You got another story
About the jeans?
Tell me about your jeans.
Doing your zip up and the jeans? No?
Yeah, that can work.
Yeah.
But that relates
blueberry,
really nicely to another muscle, maybe through here rather than your pelvic floor. But blueberry, all right. Blueberry. Picking up a blueberry with your frilly bits. And then drawing it up. Okay, so just pick it up and then draw it up. And release completely. Relax.
Did you feel anything then?
No. Did you? Did you?
I did.
That's perfect. That's what we're after. So what we want...
It's a tiny blueberry, teeny tiny.
Counts.
Yeah.
So what you do is you've got your blueberry happening just your pelvic floor and not the muscles across here, and that's what we want.
Right.
So it feels like it's not much. It feels like the tiny blueberry, totally, and that's what we're after.
Yeah.
Yeah? Okay, so let's try that again. So I've got the muscles down here I'm looking at, muscles here, and I'm looking at you not activating those, but just your pelvic floor, so your blueberry muscles. So when you're ready, pick it up, draw it up, good, and relax. Okay, so we're going to use this with the breath as well. Alright, so normal breath in, full breath out, and at the end of the breath, pick up your blueberry. And release, make sure that blueberry releases completely. That is great. So once again, I can only feel it from the outside.
Yeah.
And your women's health physio can do all the other stuff inside. But yeah, alright, so 2 more of those. Normal breath in, full breath out, pick up that blueberry, good, and release it completely. Now I happen to remember, Bronnie, when you had your second baby, it was a bit hard to come out, wasn't it? Because your pelvic floor was so good and strong. Is that right? Was it your first one or your second one?
Second.
Was it? Yeah.
Are we telling factual what happened?
Yeah.
No, I had an epidural with Toby.
Oh, did you?
Yeah, so I felt nothing.
Oh, good.
And they kept like, I had a bit of a push. I'm like, I can't feel anything.
Ah, yeah, right.
Yeah, so it was completely different experience to Max.
Yeah.
Yeah.
Oh, wow. Different recoveries too?
Oh, it was a lot, I was a lot longer with Toby.
Yeah.
I think.
Yeah.
Yeah.
Okay. So what's interesting about pelvic floor is that you want to bring on that strength, because we're looking at getting those good core muscles not necessarily core, maybe that's a different word, your good base muscles to take care of first, the pelvic floor, and some other layers underneath first, and then build on the top. But just like any other muscle, you want to strengthen it, but you want to still keep its range. So your pelvic floor, you want to come in and up, terrific, keep it nice and tight. But if you keep it there and don't release it completely, it loses its range. It can actually get tight. It can still be weak.
And the baby can't get.
Yeah, trampoline. Yeah. You can just develop pelvic pain anyway.
Actually, I remember when I was having Max, which was my first, he'd go down a bit at the delivery time, and then he'd go back up, and they'd be like, he's gone back up, and he'd go down, and he was yo-yoing there for a while. Yeah, that wasn't fun.
No. You may have needed to blame your antenatal exercise instructor for that.
No, not at all. But no one can teach you how to push a baby out, really.
Even when you think you're going to push it out, it's time it might not be.
Yes, yeah.
You learn lots by your second.
Yes, yeah.
Okay, so these muscles, you've got 4 layers of muscles, of your abdominal muscles. So you've got, from the outside in, you've got your rectus abdominis here, and then you've got your external obliques, and then you've got your internal obliques. Then you've got your transverse abs that wrap from the front all the way, from the back all the way to the front. And then you've got this linear elbow up here that joins some of those muscles together. So when you have your baby, it grows and grows, and it stretches and it stretches, and your linear elbow, which is your connective tissue down the front, has to release so that there's room for this bubba to grow. Yeah, and so it can separate. So one of the jobs that we'd like to do is to help bring that separation back together. So that's what we checked before to see how wide that can be. So your innermost layer, which is your transverse abs, can do the most good to help bring that back in again. So the muscle fibres run sort of this way. Your obliques run kind of this way, and their job is to twist and to pull. So if you switch on these ones first, it's not going to help pull that together. It's pulling it apart. And your rectus abdominis, that's just icing on the cake. That's just pretty stuff. They don't really, they count, but the priorities are pelvic floor, transverse abs, and then we build from there. Yeah? So to fire your transverse abs, to activate those, you're going to take care of your pelvic floor first, and then you're going to fire your transverse abs. Yeah? But the tricky bit is You do that through here without here. So I'm going to go back to this position and I'm going to feel, but then you're going to feel as well. So might be easier if you just relax your hands there. Yeah, wherever you like. So I'm going to go back to those pointy parts on the hips. I'm going to go under here. Okay, so when you're ready, normal breath in, full breath out. Okay, pick up your blueberry. That's it. Now peel your skin off your low-rise undies. Down here. And release off completely.
Oh, I see what you mean now. Yep.
Yeah.
I have to think
So
about
down here, low-rise undies. Yeah, sorry.
As in peel, as in, yeah. Yeah, I see. Yep. Right.
Yeah. So another story may be, this one works really well with the oldies. You've been out pruning the roses.
Right.
A little prickle, falling right down in front of your undies.
Yep.
Yeah. You can't take your gloves off or your pruning shears, so you just have to pull your belly off.
Yep.
Yeah.
Yep. Yep.
But it's not a huge contraction. It's just a little one. You know, like your blueberry was a little blueberry?
Right.
Little undies.
Little undies. Right.
Okay, so let's try it again. Normal breath in, full breath out. Okay, lift that blueberry. Good. Pull those undies down. Great. Oh, fantastic. And relax off again. Completely. Good. Okay, so what I was feeling for here is that your obliques weren't switching on to help out across here. And you're a natural.
Oh, that's good.
So what I'd love you to do is use your right hand here. Same point. So find that pointy part of your hip.
Yep.
Yeah, I'm going to take one side. You're going to take this side. Your hand just in the middle there. And your hand just under your ribs. Now I want you to do a little cough and feel what happens under your fingers. Can you feel that switching on when you do that?
Yeah.
And again. Yeah, that's just that. And relax. Okay, do a little wriggle so you can feel them. Keep your pelvis still. Move yourself a little side to side a little bit more. Yeah, feel how they come on?
Oh, yeah.
Yeah, yeah, okay.
Yeah.
So, same thing again. You're going to draw your pelvic floor. And then you're going to switch on here. Okay, when you're ready, get that blueberry. Then pull down off low-rise undies. Good. And release everything off. Fantastic. So normally, just for the camera, these will switch on. Mine, it took me ages to practice to not switch on my obliques doing this.
Oh, okay.
Yeah,
Yeah.
so it's just here, and then these babies, they want to boss out, but you want to get rid of those. So some advice we'd give now, or a suggestion would be that as a new mum, you'd go home and you practice, say, 10 to 15 of these in the morning and then in the evening, just to sort of remind the body where they're at, getting those activated so that the big bossy muscles don't take over what your inside ones need to take care of. Yeah, so that's really good. I'm just going to check that I've covered everything. Yeah, no, I think that's pretty good. Yeah. Oh, and probably just another reminder to go and see a women's health physio. Hook you up with someone. Yeah, I think that should be it. Thanks, Bronnie.
Oh,
Beautiful
forward
model.
to my six-pack being back again any day now.
That's icing on the cake, baby.